Treatment of gingivitis and mucositis. Applied directly to inflamed gums, it creates a protective barrier that counteracts inflammation and promotes healing. It is ideal for early treatment of gingivitis, even in the presence of pseudopockets, helping maintain oral hygiene and reducing the risk of periodontal disease progression. From the first to the fourth stage of periodontal disease, Chlosite is applied directly into periodontal pockets. The gel adheres perfectly to tissues thanks to xanthan gum, and the biclorexidine acts for up to 20 days, reducing bacterial load and promoting periodontal healing. Chlosite is also ideal in implantology. It can be inserted into the implant cavity before screwing the healing cap or abutment. It protects peri-implant tissues, reduces the risk of infection, and promotes long-term implant stability.